Basil. All right, ladies and gentlemen, boys and girls, kids of all ages, welcome on in. This is another Great Lakes ROTA-RC presentation. Today we are talking about mental health stigma in rural communities, and our host organization today is UW-Madison Division of Extension bringing our presentation. So thank you very much to that organization for hosting our session and our speaker. My name is Amanda Kura. I'm the Great Lakes Region Technical Center project manager, so I'm happy to be today's session host. We just have a few housekeeping items that we need to go through, so be patient. If you've been with us before, you know what it's like. If you're not, this is your first time in, well, welcome in. Some of this might be entertaining for you, informative. Either way, it's always a good time. So just hang in there as we go through a couple of these items to just inform and delight you with what the project is all about. The first is our funding acknowledgement. This is just to let you know that Great Lakes ROTA-RC is the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA, to those who love and know them. This Great Lakes ROTA project is a Health and Human Services, HHS, Region 5 grant project that covers those beautiful states you see right there: Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. But don't worry, if you're joining us from outside that region, we're happy to have you here as well. We welcome and invite anyone who wants to learn and know more about substance use and mental health information. You see our website up there in the corner over there. We will be popping more of that information in at the end, so don't worry if you can't grab it in time. We'll make sure you get it. We also want to make sure that you know more about our website resources. It's one of our grant products that we maintain and administrate. It has a wealth of our virtual education events, our partners events, and events going on not only regionally but nationally that help you know what's evidence-based and kind of what's out there in a one-stop shop kind of opportunity. It helps you get access to newsletter articles, other library, resource library toolkits that are rural kind of forward. It also gets you to those news and updates, things that are kind of up and happening, and rural supported funding announcements. It also helps you learn a little bit more about the technical assistance that we and our partners provide in rural communities to help you solve some of those community-based challenges. So make sure you check that out. This is a little bit more of a closer look at our e-newsletter. You can get signed up for that, and then we provide a broad-based overview of our newsletter that helps you kind of learn what's happening at the local level, get to know some of the content experts, ask them some questions, get into some locally based discussion about hot topics that are happening. Some of them end up as our topic presenters and speakers here in virtual education. So that's a great way to learn just, again, a little bit more about substance abuse and mental health topics, education, information, and resources. Again, it comes out once a month, and then we do a short abbreviated training a second time a month, just to remind you, training that is upcoming within a month space. So make sure you check that out. And again, we'll be giving you the information to do that. The last thing we want to remind you about is that words matter. So ROTA-RC promotes the use of affirming person-first language when discussing behavioral health disorders. We use non-stigmatizing, recovery-oriented language because we know that that can help reduce the negative bias and that promotes successful engagement in treatment recovery. So we ask all of you to help us create that space as we move into our education here today. So again, welcome on in to Great Lakes virtual education community. Thank you for helping us make that a really great space to be a part of. I want to now welcome in our presenter for today. Jeff Winton is the founder and chairman of Rural Minds, which is a 501c3 nonprofit organization that serves as an advocate and an informed voice for mental health equality in rural America. Unfortunately, due to a family tragedy, this approved and promoted and served Jeff to devote a significant portion of his life and his time and energy in fighting the stigma and the suffering that is caused by mental illness, and provides rural Americans to tell their own stories in order to assist others in similar journeys. In addition to being the founder and chairman of Rural Minds, Jeff is the founder and owner of Wall Street Dairy LLC, which is a working family dairy farm in Chakuta. Hopefully I pronounced that correctly, but Jeff will be able to correct me here in a minute. Which is a county in New York. He's also a member of a multi-generational family farm. I want to hand it over now to Jeff to tell a little bit more about his story and correct any of those parts that I might have gotten wrong. Thank you, Jeff, for being with us today.
Well, thank you very much, Amanda. And first of all, don't worry about not knowing how to pronounce Chautauqua. It's a very difficult indigenous word that many natives even struggle with, and even fewer of us can spell it. So you're in very good company. Greetings, everyone. I really appreciate you being here today. Amanda, thank you for agreeing to work with me on the slides. My team is always very nervous when I present and I pull things up on my laptop because they're never sure what I'm going to pull up. So this is the sure bet way of ensuring that we show the slides that are intended for this audience. I'm delighted to be here with this audience for a number of reasons. First of all, I appreciate the invitation by UW-Madison and the Extension Division there. My very first job out of undergraduate college at Cornell University was in cooperative extension, where I worked in Saratoga County, New York, which is over in the eastern part of the state, just north of Albany. I'm speaking to you from actually the westernmost part of New York on Lake Erie. So again, keeping with the theme of the Great Lakes ROTA-RC, I am talking to you from the Great Lakes region. And the map that you saw just a few minutes ago of the states that are involved in this program, if you look at the very tip of Ohio, the very right portion of Ohio, we are less than an hour from there. So we're very close to Erie, Pennsylvania. And then before you know it, you're in Ohio in the Ashtabula area. So I know the area that you folks cover well. Plus, I've lived over the years in Indiana. I've lived in Wisconsin. I've lived in Indiana because of my non-farm career. So the states that you represent are very important to me. Next slide, please. And we can go to the next slide. And I want to start out with giving you a little background as to why I am here with you today. And if a picture can paint 1,000 words, as I say, this picture says a great deal about who we are and why we exist. So before I get into this photo in particular, I want to take you back a few years to September 1st, 2012. It was a very beautiful September autumn day, very similar to the weather we're having here in Chautauqua County today. I'm looking out the window of my office. Our dairy cattle are out on the pasture grazing. The trees are all changing color, and it's a beautiful day, as it was on September 1st, 2012. It was also a beautiful day because it was the day of my oldest nephew, Todd Jr.'s wedding. And Todd Jr. was the first in the family in that generation to be married. So it was especially a happy mountaintop farming family experience for my family, who has been dairy farmers for several generations, primarily in this part of New York State. The wedding was beautiful at our small town country church. The reception was at a rodeo grounds that's nearby, a place where a lot of farm families have social events. And so after the wedding, we went to the reception, and after the reception was nearing its completion, I got up to leave to head back to my farm. And my nephew, Brooks, who you see on this photo, who was my nephew who just got married's brother, his next oldest brother, was there with his 3-year-old twins you see here. And he had the little boy in one hand and the little girl in the other hand. And as I was getting ready to leave, Brooks, who you can see was a very big guy, gave me a big bear hug, as he characteristically did, said, "Uncle Jeff, I just want to thank you for everything you've done for me, everything you've given to my family. I really appreciate it." Well, I didn't think much about his display of gratitude because this is a young man that always showed his appreciation, no matter how big or small a gesture was that was directed to him, his fiancee, or his two children. And so off we went. I went back to the farm because on a dairy farm, as some of you may know, life starts very early. We get up at 5 in the morning to start milking cows and feeding calves and doing all the things you do on a dairy farm. So the next day, September 2nd, was a fairly unremarkable day. We were recovering from the wedding reception, I must admit, but also planning for my mother's 75th birthday party that was supposed to take place the next day on September 3rd. So September 3rd rolled around again. We had 3 farms at the time. So I'm going from farm to farm, starting at 5 in the morning, just to ensure that everything is getting done and that everything is handled in the manner that I expected it to be. And as I was leaving the last farm to head back to my home, which was on our main farm and still is, I approached my nephew's house, a house that he was in the process of buying from my brother. And as I approached, I saw lots of red lights. I heard sirens. I saw police cars. I saw a fire truck. And I knew something terrible had happened. So I pulled my pickup truck into the driveway of his house. I jump out of my truck, and the woman across the road, who I had grown up with, come running across the road with tears running down her face and said, "Jeff, don't go any further. I just found your nephew in the backyard and he's unresponsive, and the police have called the coroner." And I'm like, "Renelle, what are you talking about? I just spoke to him the day before. I just saw him 2 days before at the wedding." And she said, "I don't know, but we're fearful that he died by suicide. He's taken his life, but we're waiting for the coroner." And as you can imagine, at that point, the world stopped and my family was forever changed. Not only is suicide and a death of a 28-year-old father of 3-year-old twins shocking enough, but what was especially shocking was the fact that this was supposedly and seemingly one of the happiest, most outgoing, gregarious young people you would ever want to meet. He seemed to have everything going for him. He was engaged to be married to the father, or to the mother rather, of his twins. He was buying this house from my brother. He worked part-time on our farm, but he also had another job off the farm at a local steel mill on Lake Erie that was providing him with wonderful benefits. And so we had no idea that he, of all people in our family, were contemplating ending their lives. This photo that is on the screen right now was literally taken the week before he died. If you can see over his shoulder, it's Niagara Falls, which is about an hour and a half from where our farm is. And evidently, he had been planning this for at least a week, and he wanted his children to see Niagara Falls for the first time with their daddy. So we had really nothing to go on because this came as such a surprise. The only hint of what happened, besides the obvious, was that he left a note in the pocket of his jeans for his 2-year-old two twins for when they were old enough to understand why their dad felt that he needed to leave them at this point in time. And so my family went from celebrating a wonderful wedding and the marriage of his brother to 48 hours later, now starting to plan a funeral. So we pulled ourselves together the best we could. We went to the pastor's study the next day at our local United Methodist Church and began preparations for saying goodbye to Brooks. And the pastor took a look at my mother, who had helped raise my nephew, took a look at me, took a look at his brother and his father, and said to us, I don't know how to tell you this, but there's a lot of people in this community that don't think you should talk about suicide. They actually have gone as far as saying, we think maybe you should come up with another excuse as to what he died from. Perhaps he died in a farming accident. Perhaps he died of a heart attack. And my mother, who is a very quiet, very gentle, behind the scenes kind of woman, with tears running down her face, pounded her fist on the pastor's desk and said, Pastor, this has been going on in this farming community way too long. We're losing too many people to suicide, and no one is willing to talk about it. This is going to stop with my family. And I've told this story hundreds of times, and I still get choked up telling it because it's like it just happened yesterday, and I can hear my late mother's words resonating through my hearing. So we went from that meeting at the pastor's study to the next day, which was his funeral. And I was asked to give the eulogy, which, as you can imagine, was not an easy thing to get through for a nephew who you loved dearly. And at that point, after I was done with the eulogy and the service was over, and we did talk in detail, at least as much detail as we knew about my nephew's suicide, we had other farm families lined up for hours, not just to express their condolences, but to tell us their story, to tell us what had happened in their family, in some cases, generations ago, that they had never felt that they were able to tell to anyone. And because of the courage and the candor and the honesty of my mother, this young man's grandmother, all of a sudden the floodgates opened and other farm families in this area, this town of 500 people, where my family has been for generations, felt that they not only had permission to talk about what had happened in their family, but they had an obligation because they knew something had to be done with this. That day, the seed for Rural Minds was planted. Now, you might ask, why did you wait several years since Brooks died in 2012 to launch this organization just 3 years ago? And the reason is these 3-year-old twins. The family, working with their mother and others in the family, honestly felt that we needed to lay the groundwork and do our research to ensure that we were ready when we did launch the organization. But more importantly, we wanted my nephew's children to be old enough to try to fully understand what happened and to try to process what suicide is all about. So 3 years ago, and the kids are teenagers now, they're about to start driving, and the most wonderful young people you would ever want to meet. We had the conversation, their mother had the conversation with them, and they miss their dad tremendously, but they now understand a lot more than they did when they were 3 years old when their dad died. So Rural Minds was founded 3 years ago this month in October. Next slide, please, Amanda. And I'll tell you a bit about the organization and the work that we do and what we achieve to process. So, what drives Rural Minds is our mission, which, as Amanda kindly said, is to serve as the informed voice for mental health, specifically and solely in rural America, and to provide mental health information and resources. Our vision is a rural America where there's no more silence, suffering, or stigma surrounding mental illness. I spent a good part of my career until we launched this organization working in the healthcare industry, specifically working for companies that worked in mental health. And so I thought I knew quite a bit about this. But once it became personal, once I lost my nephew to major depression, I realized I really had very little idea of what needed to be done. So I started reaching out to a lot of other major nonprofit organizations, and I would imagine that some of you represent those organizations today. And many of the organizations I reached out to that are national in scope, that are very long-standing, wonderful organizations, basically told me that they hadn't really focused much on the 46 million people that lived in rural America. That because the bulk of our society resides in urban and suburban areas, that not a lot had been done yet in rural America, even though we represent 14% of the population in the United States. So it was with their encouragement and with their blessing that we launched Rural Minds. And, it was a very heartfelt and very honorable proposition that they put forward because normally when a new nonprofit organization is launched, many times it's looked at as, gee, just another group that's going to divert some of our funding. That was not the case at all with our 501c3 organization because the other organizations that work in this space knew there was an issue, but they knew they needed people like me, like my family, and our other colleagues who grew up in rural America, who speak the language, who understand the unique challenges of people in small town America, to really try to help them make sense of this and to help turn things around. So again, we solely focus on people in farming communities like where I live, in fishing villages, in mining communities, the indigenous community, the Amish community, which is very prevalent where I am here in Western New York. And knowing the states you all represent, I know you also have large Amish communities. So anyone that is living in rural America is our people. They are the people that we advocate for on a local, state, regional, and national level. Next slide, please, Amanda. And I'm going to go through some of these slides pretty quickly. And if it's, certainly something the organizers would like to do, I'm happy to have these slides shared with you. I'm sure this is not going to be a surprise to many of you since I know you represent organizations working in rural America. But compared to our urban counterparts, rural Americans have a much higher depression rate and suicide rate, but we're less likely to access mental health care services. Again, either because they don't exist or because they're very limited or largely because of the stigma that still exists in many rural areas when it comes to mental illness and substance use disorder. Next slide, please. So these are some statistics that I'm sure you folks have probably seen, and these are on our website, so don't worry about jotting a lot of these down. But according to the latest stats from the CDC, suicide rates among people living in rural areas are 65% higher than those living in large urban areas, and young people living in rural areas are 55% more likely to die of suicide than those in urban areas. Another statistic I saw recently was that within the last year, 1 out of every 5 or 20% of high school seniors, or not just seniors, high school students considered suicide. 20% of our young people considered suicide. That's a staggering statistic and something that we are hoping to do something about, working in conjunction with many of you. Next slide, please. So these are some statistics that, again, I will not go over. I'll quickly breeze through some of them. I've already talked about the 46 million people that live in rural America. Again, knowing what you all do, you know this statistic that the opioid overdose rate in rural communities is 45% higher than in urban areas. There are a lot of other statistics that are more geared towards occupations in rural areas. One in particular that hits close to home for me is that growers and producers, farmers and ranchers are twice as likely to die by suicide compared to other occupations. And you may already know that, but one thing that I would think many of you don't know, that another profession that follows almost in the footsteps of this terrible statistic is that of veterinarians, the people who care for our dogs and cats and cattle and horses. And we're going to be talking about that in a little while. Of course, veterinarians are a key part of the fabric in rural America. And there is a huge and growing issue amongst veterinarians in this country. And we've got some programming that we just launched actually in the last couple of weeks that is starting to address this. I've talked about the youth statistic, and again, the suicide rates are sadly growing at a much faster pace among rural youth than urban and suburban youth. Next slide, please. These are, again, stats that I'm sure many of you know because of the work you do. 3/4 of the rural counties here in the United States lack a psychiatrist. Here in my own county, we had a psychiatrist, but he's moved to a more urban area of New York where he will, I would imagine probably enjoy a greater compensation and other things that he probably did not have when he was working in a more rural area like where we are. Telemedicine helped so many of us, especially during COVID. But the fact remains that nearly 30% of people who live in rural America have no broadband internet. It's not that they can't afford it, it just doesn't exist. So we can't necessarily rely on telehealth to help people who are struggling with any kind of health disease in rural areas because, again, they may not have access. Here on my own farm, I have internet. It's spotty at best. And I just hope and pray every time I give a talk like this, it doesn't stop working. But my farm manager, who I'm looking at his house right now, he lives a quarter of a mile down the road on the farm with his family. He does not have broadband because my house is the last one that the broadband company would install it in years ago. And they will not go another quarter of a mile down the road to service Greg and his family or the other families that live beyond them on this small country road. So that's something that we are addressing as well. Primary care physicians, finding a good primary care physician is a huge issue. When I moved back to the farm where I'm speaking to you from 3 years ago when we launched Rural Minds, I was living in northern Illinois. And I had all my care team there. I had everything I needed. I moved back to this area where I grew up. And I waited 6 months to get into a local primary care provider because that's how long the waiting list was. Fortunately, I didn't have any health issues. I just wanted to establish care. If I had had some kind of an emergency, I would have had to go to the ER at the local hospital. And again, we don't have many local hospitals in rural areas because so many of them have closed and are merging with others. Next slide, please. These are some things that I'm sure will resonate with you that are unique to people in rural America. And I spoke to a group of beef cattle farmers over the weekend. And when I was going over this slide in particular, they were all nodding their head. Growing up in a rural area, especially on a farm like I did, you are taught not to ask for help. You are taught to be self-reliant. You are taught to be independent. You are taught to pull yourself up by your bootstraps and not talk about your issues and to get over your problems. And unfortunately, that has caused a great deal of the stigma that exists today as it relates to mental health and substance use disorder. In small towns, everybody knows everyone's business, and that can be a double-edged sword. So when my nephew died, because it is a small area and everybody knows my family, everybody gathered and provided us with the support we needed. But the news traveled like wildfire, as it does in small towns. I've had farmers say, even if there was a mental health clinic or provider in my community or nearby, I more than likely wouldn't go because I don't want anyone to see my pickup truck parked outside. Because in small towns, everybody knows what everybody drives. So that has certainly contributed to the issue that we are facing. The difficulty getting an appointment. I already told you what I went through personally with primary care. So if you have that issue with a primary care provider, you all know that it's especially trying when it comes to the very limited resources we have in rural areas that provide mental health resources and the time and transportation required. Here in rural New York, it's a problem, but you normally only have to travel maybe an hour to get to a local healthcare provider. But we do a lot of work in the Dakotas. We do a lot of work in Montana, where we've had people tell us we have to drive 3, 4, 5 hours to get to our healthcare provider. And that's one way, by the way. And then we have to take time off from work. And many people in rural America do not have 9 to 5 type jobs. Certainly farmers don't. It's hard for farmers to get away from their farming operation. And many other people who are hourly workers, it is a huge burden for them to take the time to get away. In rural areas, as you all know, we don't have mass transportation. We don't have train services. We don't have cabs. We don't have buses. We don't even have Ubers here in the area I'm talking to you about. So if a person doesn't have their own car or truck, it's many times very difficult if they don't have somebody else to call to get to their healthcare provider. Next slide, please. So again, the internet we've talked about, as you all well know, many people in rural areas are uninsured or underinsured. I gave a talk in Indiana recently where I had a gentleman stand up and he said, I have very poor insurance. He said, I am also living with diabetes in addition to my bipolar disorder. And he said, I had to make a decision. He said, I know if I don't take my diabetes medication, that will kill me. He said, my bipolar disorder may kill me as well. But he said, I can't afford both medicines. And he said, so I had to make a decision. No one should have to make that kind of decision. And, we'll be talking a little later about the prescription assistance programs that many pharmaceutical companies have that unfortunately don't seem to be as well known as what they need to be and would be a huge help to people that are in the same situation as this gentleman. I don't have to tell you folks who work in rural America that living in rural areas can be very isolating in times. I mean, I'm looking out the windows right now, and except for my farm manager's house, I don't see anything except for cows and barns and the creek that runs through the property and beautiful trees. And, during COVID, it was very lonely for a lot of people in rural areas because you couldn't necessarily just walk next door to your neighbor. And especially youth felt that sense of isolation. The agricultural economy is a roller coaster. And again, I grew up on a farm. I've been working in agriculture my entire life. We have good years and we have very bad years. And so you can't predict what is going to happen because largely part of our livelihood depends on Mother Nature. And I don't have to tell you what's happening with climate change and all the things that are happening in this country. I fear for the farmers in Florida right now. I just posted something about this earlier this morning. But we are in a very difficult time in the agricultural community and many rural areas, even if people aren't farmers per se, their livelihood depends on the farming community because they're diners, they're barbers, they're the local grocery store that basically catered to people that work in agriculture and work in farming communities. So it's a multifaceted issue. Next slide, please. And I'm going to try to get through this as quickly as I can because I want to leave some time for um, questions. And Amanda, just to do a time check, we have just until 1 o'clock Central Time, correct?
But that's
Until
correct.
1 o'clock Central Time?
That's correct.
Yeah, okay, great. Okay. And so, again, stigma is a huge problem. We find stigma, of course, in urban and suburban areas, but you especially find this issue in rural areas because, again, to this day, many people don't consider mental illness to be a true illness. They will talk about cancer, they will talk about heart disease, they will talk about diabetes, they certainly talk about COVID now. But nobody wants to talk about substance use disorder. Nobody wants to talk about schizophrenia. Nobody wants to talk about major depression. And so, a part of what we're doing in Rural Minds is getting people to understand that mental illness is an illness. That's why we call it mental illness. And in many cases, of course, there is a genetic predisposition. Certainly, there is in my family, but no one talked about it until my nephew died. And so now we talk much more openly about it. Other members of my family have sought help after my nephew died, but it unfortunately took the death of my nephew to get the rest of my family to admit that they were having an issue. So we are really urging families to have this very candid conversation so that the next generation can be vigilant, that they understand that part of this is out of their control. It's just who they are. It's in their genetic makeup, and they need to be aware that they may also suffer somewhere down the road. People in rural America, and again, I see this firsthand now that I'm living back here, tend to be a little suspicious at first of people from the outside. They want to get to know you. You have to earn their trust. They want you to look them in the eye. They want to feel your firm handshake. And so I tell people, even with telemedicine, there are a lot of people in rural areas that aren't comfortable getting on a screen like this and talking to a healthcare provider who may be in Los Angeles, who may have nothing in common with them. They want to sit down and develop a relationship with somebody and eventually learn that they can trust that individual. So, what we are attempting to do is go where people in rural America are already going, where they already trust the information that is being given to them, whether it's communities of faith, whether it's the Grange, whether it's 4-H, whether it's FFA, the Farm Bureau, any of these groups that have had long-standing relationships in rural communities are where people go for trusted information. So rather than creating new venues or new support groups for people, what we're doing is taking our message and taking our materials and our work into those existing communities so that they can have candid grassroots conversations with the people that they serve. Next slide, please. I've already gone through this, so you can pop through that if you would, Amanda. These are just some of the many partners that Rural Mind has. I'm sure you will recognize many of these logos. Many are other large national, international mental health organizations that, again, I reached out to and who encouraged us to start our group. And others are for-profit companies that work in both healthcare as well as those that work in the agricultural and rural America setting. And so I just wanted to give you a quick snapshot of some of the companies that have joined our cause over the course of our last 3 years. Next slide. This is a program that is on our website, and I urge you to go to ruralminds.org. It's a toolkit, a meeting in a box, if you will, called the Rural Mental Health Resilience Program. It was done in conjunction with the National Grange, which is the largest and oldest agricultural nonprofit organization in the country. They have 1,500 locations, including many of the states that you represent. It's a program that has anything you need to put on a community conversation. And everything on our website is downloadable and printable. So we have fact sheets, we have PowerPoint presentations, we have press releases, we have templates for banners to promote the program. Anything you need for putting on a community event can be found here. And I believe it's still on the homepage of our website. We've had so many new programs launch recently. I'm not quite certain, but if not, you can search and find it. But I'm pretty certain it's still on the homepage at ruralminds.org. Next slide, please. These are just some of the many elements that you'll find when you go there. We're proud of the professional look. We're proud of what our team, which is a very small team, we only have one full-time employee. I'm a volunteer. I don't get paid. I never hope to get paid because this is a labor of love for me, keeping my nephew's memory alive. And we have many volunteers who help us do wonderful things like this and a handful of other consultants. So again, just a snapshot of some of the materials that you'll find when you go to our website. Next slide. This is a new program that I mentioned that was just launched last week in conjunction with my alma mater, Cornell University, and specifically with the College of Veterinary Medicine. As I mentioned, there is a growing incidence of suicide among both veterinary students as well as practicing veterinarians. And so the dean of the vet school at Cornell, Dean Lauren Warnock, who's become a very good friend of mine, who is a cattle veterinarian originally from the state of Montana, and then he joined the vet school at Cornell, said, we have to do something about this. We're losing too many people, both in our college and in the profession. And so this is a program that was rolled out just last week, and it was rolled out nationwide. So it was rolled out to all the other vet schools across the country, University of Wisconsin, Ohio State, Purdue, all the states that you represent now have this program. And it's a free course that's available to anyone. So you don't even have to be a veterinarian to access this course. It's open to anyone who has a spare hour to take this. Many of these online courses from Cornell, there is a fee associated with. But due to the generosity of people at Cornell who saw the need for this, this is being made available free of charge to anyone who is interested in this. And it's done in modules, and you'll see a couple modules that I've done, so that if a person only has 15, 20 minutes, they can do that, then they can go back, then they can go back. And just a warning, there's a test too. So just like any good test, of course, there's a test. So as I tell people, where else can you get an Ivy League education free these days? So I would suggest that you check this out. I know this is on the homepage of our website because it's a brand new program that we've already had many, many people take in the course of the last few days. Next slide. We have a series of webinars, and all of our webinars are again free. They're all confidential. They're on a number of different topics, and you can find all of the past webinars we've done the last 3 years on our website. They're all archived there. Next slide. We have one coming up in a couple weeks that I strongly recommend you join us for. This is specifically on postpartum depression in rural America. As many of you folks know, postpartum depression is a huge issue in rural America, and it's growing in nature. And so, with the support of two of the biopharmaceutical companies, we have a free seminar that will be held in just a couple of weeks. And we do ask that people pre-register. And if you pre-register and you can't make it, we will send you the link to that webinar as soon as it's over. So I highly recommend you sign up for this, and please share this information with others. This again is on the homepage of our website. Next page. Next slide, please. We have a newsletter as well. It's free, called Moving Forward. So I would ask you to sign up for this. We don't send a lot of emails out, so don't worry that you're going to be getting a lot of junk and spam mail from us. But our newsletter has a lot of really good and I think timely and interesting information in it. So please do sign up for this. Next slide. We're doing a lot of media work. I am the chief spokesperson for the company. We have other people that also do this work. So we do a lot of work with the rural media. As you folks all know, there are rural radio stations, rural television stations, rural newspapers, rural magazines. This is just a snapshot of some of the many publications we've worked with, but we also work with other media, such as Psychiatric Times. I just co-authored a piece that is in the current issue of Psychiatric Times. And we work with more broad-based media as well, such as NPR and PBS and the New York Times. So we're trying to educate both urban counterparts and rural people about this growing epidemic. It's important that people that live in cities and suburban areas understand the barriers that we face because many times they have a very influential voice when it comes to policy matters and other things. And so we have always felt that it's in our best interest to ensure that even though they come from a different world and they live a different existence that we live, that they're aware of what people in rural America are facing and many of our unique challenges. Next slide. And this is the end. There's one more slide, but I always like to end with this. I think it's a very profound quote by Harlan Cohen. Sometimes the loudest cries for help are silent. That was certainly the case with my nephew. Again, we had no idea that he was suffering in silence, but clearly he was. The next slide has our contact information on it. I've already mentioned our website, again, ruralminds.org. We're on a variety of social media platforms. Our group of volunteers and part-time consultants do a great job with social media. So I would encourage you to follow us on social media. And if any of you want my personal email, it's easy to remember. It's Jeff, Jeff, at ruralminds.org. And our organization is available to do these kinds of talks, either over webinars like this or in person. So if any of you have a need with your organization where you would like to have a similar presentation or a variation thereof, please let me know. And working with our partners, we would be happy to accommodate that request as long as someone is available. So with that, Amanda, thank you very much for working with me on the presentation. And thank you again to Great Lakes ROTA-RC and to the University of Wisconsin Division of Extension for inviting me here. And in the last 10 minutes or so, I'd love to entertain any questions. If any of you were sending questions on the chat, I didn't see them because I don't have my glasses on, but I would imagine Amanda was seeing them, or please feel free to ask them now. And I would ask Amanda if I could to get some of the comments and questions that people may have been making during the presentation after we're done. But I normally don't watch the chat feature just because it's distracting and I have poor eyesight. So with
No
that,
worries.
thank you very much. And I appreciate your time and your interest today.
Thank you, Jeff. On behalf of all of us, I want to thank you for giving us your time today. I'm going to feed you those questions, comments. I'm sure lots of warmth and regard as well. I'm going to close this out here, and then we're going to stop the recording. One of the benefits of being on live is that people get some special time with you as a presenter. So I'm just going to go ahead and close out some of these quick comments and housekeeping items here at the end. On the screen, you will see our feedback survey. If you want to throw your phone up there and grab that, you can. I will also pop it in the chat here at the end. A reminder that the availability of the session content will be put up on our website, which I will be giving you. Please give us about 7 days to get that content up on the website. We do always send that out to everyone who registered for the event. I think we had just shy of 200 participants register for today's session, which tells you just how popular it is, and lots of people wanting to know more about rural mental health and the stigma that surrounds it. For those of you who participated today, you will be getting a certificate of attendance. If you would like some information on how to apply for CEUs within your state, please connect with me after this event once you have your certificate of attendance, and I will make sure that you get the additional information to be able to apply within your state. But we do not offer CEUs, just as a reminder. Here's the information that you need to connect with us. We do have an email for the project. There's our website. A reminder for our newsletter. I will make sure that as part of the resources that we offer post-event on our website for this event with Mr. Winton, that we connect his newsletter and his website to the resources as well as the slides and today's recording. So we'll make sure that we have a nice toolkit of resources for you to be able to get today's event and to connect to the things that Jeff shared with us today. Reminder that we're also on Facebook. We connect to partners, we share awareness events and connections to the virtual training that we have coming up. So make sure you connect to us on Facebook as well. And then a reminder, if you have challenges that you're trying to solve on the local level and you'd like some help from the project, we do offer technical assistance. There is a link to get connected. I will put all of those links in the chat when I stop the share. The last thing I want to remind you of today, in November, we have Understanding Stress and Stigma within the Field of Agriculture and Rural America. This is being hosted by the Ohio State University Extension, so make sure that you check that out coming up in November. I am going to stop the share. I'm going to ask Christina to please stop the recording.